So now we're going to talk about the cardiovascular system and how blood cycles through the body. So in this figure here, it just shows how the left side is deoxygenated blood represented by blue, and the right side is oxygenated blood represented by red. So the pulmonary lung circulation and systemic body circulation are the two cardiovascular systems. This is the anatomy of the heart. So there is the heart base, which is the cranial end or the top portion. And this is where the auricles are found. So there's a right and left auricle. And then the apex of the heart is the more pointed caudal end, where the left ventricle is found. And this is how, the next slide is going to show how it looks like on an x-ray, but the heart base is the more cranial portion, and the apex is definitely the caudal pointing portion. So here is what a right lateral x-ray would look like, where the heart is located. So you can see the heart in its shape here, where the apex is pointed down towards the sternum, and the aorta is branching and arching upwards to the dorsum of the animal, and so the apex is shifted a bit to the left, and you can see the heart and how it sits in the normal thoracic cavity. So there are a few coverings of the heart. The pericardium is the fibrous sac that contains the heart, and within that is the pericardial sac, which has a serous pericardium that contains a visceral layer and a parietal layer, just like all the other visceral and parietal layers in the abdomen. There is the visceral layer, which is the layer that is closest to the structure. In this case, it's the layer that's closest to the heart, and the parietal layer is the outside layer. In between this is where the pericardial space is, and this is where the fluid is filled with pericardial fluid. That is the lubricating space or fluid there that allows for friction to not happen when this is moving, the heart's moving inside the pericardium. This is also where pericardial effusion happens. So in the picture here, you can see the serous pericardium where there's the visceral and the parietal layer, and then that pericardial space. That's where you would see pericardial effusion. So not to be confused with the coverings of the heart, these are the layers in the wall of the heart. So don't get epicardium and pericardial mixed up. Epicardium is referring to the actual layers in the wall of the heart. So epi meaning above or on top, meaning that this is the layer that is on top or the outside. Myocardium is the actual muscle layer. So myo means muscle, cardium refers to the cardiac. And endocardium is the innermost layer. Again, endo meaning inside. So those are kind of self-explanatory for where they lie within or on top of the heart. The endocardium covers the papillary muscle as well, which you can see in this picture here, that white, it says trabeculae here, but that is also where the papillary muscles are. So the internal anatomy is very self-explanatory at this point. You've probably seen this image a million times. Left side being the right side, where there is the deoxygenated blood represented by blue. The left side, the more pink for the oxygenated blood, and then the dark red being the myocardium and the ventricular septum there. So there's the right atrium on the top left, the right ventricles below that in the darker blue, left atrium, the lighter pink on the right hand side of this image, and the left ventricle below that in the darker pinky color, I guess. And then the myocardium again is that outside layer, the actual heart muscle. So here's that image once again. This time You can really see the interventricular groove. So that is that um, kind of line that is separating the right ventricle from the left ventricle. And you can see this on the outside of the heart, also where the coronary blood vessels are. So interventricular groove is there, seen on the outside. So cardiac valves, there are four of them. They are one-way valves that control blood flow through the heart, so they don't allow blood to flow backwards. So they go one way, and they are the left atrioventricular valve or mitral valve, the pulmonary valve or semilunar valve, the aortic or other semilunar valve. So pulmonary being the right side, semilunar being the left side, and the right atrioventricular valve, which is also known as the tricuspid valve. So these do not allow blood to go from the atrium into the ventricle and then back into that atrium again, or from that right atrium into the pulmonary artery and then backwards again into that ventricle. Um, so this is when you would hear a heart murmur if there was blood allowed to be regurgitated back in through those valves there. The chordae tendineae are those fibrous structures that are actually holding the valves in place and preventing them from opening backwards. So next we're going to talk about cardiac conduction system, or the ECG is basically what the conduction system looks like on paper. So here is the conduction system of the heart. It starts in the sinoatrial or SA node, which is the pacemaker of the heart, and that is found in the right atrium. It then goes down the internodal bundles and fibers, um, and it also goes over to the left atrium, so the intrabundle and fibers in the left atrium. So that is one part of it. And then it goes downwards to the ventricles, so the atrioventricular node or AV node. Um, it goes to the Purkinje fibers, which go to the lateral wall and the septum in the right ventricle, and it also goes to the Purkinje fibers in the septum and the lateral wall in the left ventricle. So these don't all happen at the same time. Right and left atria and then right and left ventricles are usually how the conduction system is seen. There are some really good animations that show actually how the heart is pumping when this is happening. The cardiac cycle is defined as one heartbeat being produced from one cycle of atrial and ventricular contractions, followed by relaxation. So systole equals the myocardium contracting or working, and diastole is the myocardium relaxing and repolarizing, or refilling is another word I've heard. Each chamber goes through systole and diastole, but they don't happen at the same time. Heart sounds are produced by valves snapping shut. So in one cardiac cycle, you can hear two distinct sounds. The lub is after the atrial systole happens and the tricuspid and mitral valves are snapping shut. The dub is after ventricular systole and is when the pulmonary and aortic valves are snapping shut. So that's what you hear from the lub dub. Further to that, stroke volume is defined by the representation of the heartbeat and is determined by two factors. There's preload, which is the volume of blood received from the atrium, and afterload, which is the physical resistance by the artery that the ventricle is injecting blood into. So it can be affected by the length of the cardiac muscles in cells, but preload is how much blood is actually coming into that atrium, and afterload is whether that artery that atrium or the blood is injecting into is from the ventricle is constricted or dilated. So that is the physical resistance. So this diagram here shows the difference between arteries and veins. The obvious difference is that the arteries need to be able to pulse to send blood through to the arteries, to the organs, and all the tissues in the body. And the veins are responsible for bringing deoxygenated blood from those areas back to the heart to be reoxygenated through the lungs. So the artery needs to have a thicker muscle layer and more elastic tissue so that it's able to pulse and have that muscle layer in order to be able to send that blood through the body. And for that reason, it's thicker in the arteries and it's thinner in the veins. And the connective tissue is the opposite. So it is thinner than the smooth muscle layer in arteries, and it is thickest in the vein layers. There are also valves in the veins that help for the blood not to be able to be backflowed so that it can continue to be pushed forward to that right atrium in the heart. And arteries don't need that because they have that thick muscle layer, which is pulsing blood forward. So there shouldn't be a reason for blood to be going backwards because it's got that muscular contraction. So this would really be a kind of refresher course, I guess, from biology. Arteries in general always carry oxygenated blood, except for when they are carrying blood from the pulmonary circulation. So again, arteries always have oxygenated blood, but the one time they don't is when it is the pulmonary artery carrying deoxygenated blood to the lungs. Um, Otherwise, arteries come in pairs. There are elastic and muscular ones. The elastic, the largest is the aorta, and the muscular ones are the arterioles, which are the small branches in the arterial tree. Capillaries are microscopic blood vessels that branch from arterioles. They occur in groups called capillary beds or networks, and they are really thin and they are only one endothelial cell thick. So this allows for the exchange of gas and nutrients. If they were thicker, that would be really hard to do. This is where the arterioles are connecting with the venules or the veins. So the capillary beds are where the two deoxygenated and oxygenated blood kind of meet up and exchange gas and nutrients. So the circulation of blood in the fetus receives oxygen from the blood of its mother. The lungs are not used because they would be drowned if they were being used. So they get their oxygen from their mother through the placenta, through the umbilical vein. So as soon as they're born and they take their first breath, then that's when they start using their lungs to oxygenate their own blood. Before that time, the foramen ovale and the ductus arteriosus are open, and this allows the exchange of that blood to go back and forth between the right and left side of the heart. But when the lungs are functioning, that needs to be closed. So foramen ovale and ductus arteriosus, they close really soon after birth, and if they don't, then those are serious complications that need to be fixed surgically, like the patent ductus arteriosus or PDA. So the pulse is the rate of alternating stretching and recoiling of elastic fibers in an artery as blood passes through it with each heartbeat. So every time the heart beats, the pulse is felt as a beat stretching that artery, and that's what you're feeling. The left ventricle doesn't eject blood continuously. It is in pulsations, as we know. That's why it's called a pulse. And this is how you can feel the pulse rate. So it should be kind of hitting your finger in that femoral pulse, and there is a strength and a character involved in that. So if the strength or the character of that pulse is very weak, then that can tell us that the heart isn't being able to eject that blood out of that ventricle well enough, or the blood pressure is low for whatever reason. But the auscultation is not a true pulse, so the auscultation is actually listening to the heart rate and cannot be called a pulse. Blood pressure is the measurement of the amount of pressure that flowing blood exerts on an arterial wall. Um, so dependent on the interactions with the heart rate, the stroke volume, the diameter and elasticity of the artery, and the total blood volume. So blood pressure, if your heart rate is low, then the blood pressure could be low. If the stroke volume is not sufficient, then the blood pressure could be low. If the diameter and the elasticity of the artery is wide, so there is vasodilation, then the blood pressure could be low. If the total blood volume in the animal is low, then it is most likely going to have a low blood pressure. So any one of these factors can contribute to blood pressure, but just one of them can make blood pressure be low or high. But usually in an animal that was otherwise healthy, there's usually a couple of these going on. So they might have a low heart rate under anesthesia, or because of sedative drugs such as dexdomitor. It's another reason we don't use dexdomitor in animals that don't have a healthy cardiac system, because it lowers their heart rate so low that if they are already having problems ejecting blood out of the heart because the heart isn't functioning normally, then lowering that heart rate is going to further contribute to not being able to properly eject blood out of that heart, which will definitely affect the blood pressure. If an animal is bleeding out or is severely dehydrated and their blood volume is low, or their vasculature is low, then they're also going to have low blood pressure. So the kind of anatomy of a blood pressure is there is the systolic blood pressure, which is the highest number, the diastolic blood pressure, which is the lowest number, and the mean arterial or MAP, which is the average pressure during one cardiac cycle. So if you have a Doppler system, that's the systolic blood pressure that you are taking. Apparently, some people with a really keen ear can hear the diastolic on a Doppler. I don't believe I have ever heard that, but apparently you might be able to hear that diastolic blood pressure on there. Um, and the mean arterial pressure is oscillometric blood pressure monitoring can catch that. And that's the average. A lot of people are now saying they think that the Doppler is more of a measure of the mean, as the actual systolic pressure is higher, and that the Doppler blood pressure isn't able to catch that. We also sometimes think of, or a lot of anesthesiologists will recommend that you add 11 or another number to the systolic to actually get, or sorry, the mean to get the systolic. Um, so if we get 90 for a cat on a Doppler, so people are suggesting that it's the MAP, and that the actual systolic is more like 101, or there's a couple different numbers that float around there. But just good to know, especially in the cat, that sometimes the systolic blood pressure could be a bit higher if you're using a Doppler. So now we'll talk about electrocardiography, or ECG or EKG. This is based on the electrical activity of the heart, and it is detecting the electrical impulses on the surface of the animal's body. So there is um, instances where an animal can be dead and still have electrical conduction, and that can show up on the ECG. So this has happened a few times in my ER where they've had pulseless conduction. So they look like they could be alive if you watch the ECG for long enough, but they have actually ceased cardiac uh, like heartbeats minutes ago sometimes. So the ECG is showing us the PQRST complex, which is shown here and on the next slide. Okay, so sometimes this can be a little bit confusing, I think, but basically the P wave is the time it takes the wave of depolarization contractions to travel from the SA node through the atria. So this is corresponding to the mechanical activity of the atrial contractions in a normal animal. So the P wave is those atrial contractions. It's small, but that is what that represents. The QRS complex is the time of ventricular depolarization or contraction, and it corresponds to the mechanical activity of ventricle contraction. So it is composed of three different waves. The Q wave corresponds to the depolarization of the interventricular septum. The R wave corresponds to the depolarization of the main mass of ventricles, so it is a large wave. And the S wave corresponds to the final part of depolarization of the ventricles near the base of the heart. So the R wave is the largest wave because it is doing the most, so that might help. And then finally, the T wave is the time of ventricular relaxation or repolarization, and it corresponds to the time taken by the ventricles to get ready for the next contraction by filling with blood from the atria. So kind of a deflected T might help you remember that there's no activity and the ventricles are basically getting ready to refill with blood. T waves aren't always upside down like they are in this picture, though. They are often reflected up, but they are always shorter in length than the R wave unless there is a problem. So another part of monitoring is the ultrasound. So the ultrasound are sound waves bouncing off parts of the heart that come back to us. So echo, that's why it's called echocardiography, or I guess it's the same, like the echoing of the sound waves back to us in the form of a picture. These are used to evaluate the size, shape, and movement of the heart and its parts. In our ER, we have our ultrasound right next to our table where we receive urgent or critical patients. And often the ultrasound is first, if not second, to anything else we do in some patients. So if they're severely dyspneic, then we do a really quick exam on them, try to get an SpO2 and see where that is at. And a lot of the time, if we're able to without a lot of stress, we'll quickly look at their heart or their lungs with an ultrasound to determine if there is fluid in there or if there's a problem with the heart. So this is really important in emergency medicine, and it is way less stressful than trying to get an x-ray on an animal that could potentially die just from stress alone if they're having a respiratory emergency. So here is a great cross-sectional view of a heart. So you're looking down on it from the top, if the top was cut right off or the base of the heart was cut straight across, and you were to remove that as a lid basically, and look down on the heart. So this one's not facing us perfectly, but you can see the right atria, RA, the right ventricle. You can even see the septum kind of dividing that in the middle, and then the left atria and the left ventricle. And in between the RA and the RV, there is a really bright spot and then a more of a leaf-looking structure. Those are the valves. Same with the LA and the LV. You can see two little spots there. Those are the valves, and they're actually open in this picture. So this is a great picture to be able to show us where those valves are located and how they look on an ultrasound. So this is a two-dimensional cross-section image of the heart. And if this was a real live ultrasound, you would be able to see the heart moving, obviously. And on the bottom, there's an ECG that corresponds with the contractions and filling of those atria and ventricles. So if you have a chance and you have this available to you, you should try to see if you can get a patient, or if you have one already that's there for an ultrasound and you have this function, just watch these atria and ventricles corresponding to the ECG on the bottom of the screen. Doppler echocardiography is another really helpful thing that we use um, to determine the backflow of blood if we're looking for like valvular stenosis or reasons why an animal might have a heart murmur. So this measures the flow of blood through the heart and it adds color to it so you're able to see blood flowing back and forth in red and blue colors. So in this image here, looks like there is the right atria, the right ventricle. It looks like it's probably trying to determine that pulmonary artery or pulmonary valve there, to see if there's backflow from the atria or into the atria, sorry, from that valve. So this would be an evaluation for valvular stenosis and reasons for heart murmurs. You can also see chordae tendineae rupture on here. I have seen them where you can actually see the valve fluttering or like waving in the air, it looks like, because it's been ruptured from the side of the heart wall there, because the chordae tendineae have ruptured. So basically that valve is just fluttering in the wind, per se. So you can see that really well on some ultrasounds as well. So sites for venipuncture or venipuncture, um, obviously the main ones are the jugular vein, the cephalic vein, the femoral vein, or otherwise known as the saphenous vein. So in cats, we use the femoral vein, or call it the medial saphenous vein. They are the same, or the lateral saphenous vein. So the femoral vein basically wraps around that hock, and then forms the saphenous vein on the lateral aspect. On the medial aspect of that limb, it's the femoral vein, or medial saphenous. Same in the cow and the horse, except you can use the coccygeal vein in a cow. Otherwise, jugular veins are the ones that are mostly used. Um, Usually for cephalic veins in cats and dogs, we try not to use those and leave those for catheter placement. Just for fun, they really want us to know that in lactating dairy cattle, you should never use the superficial caudal epigastric vein, otherwise known as the milk vein, because you can cause um, infections. So lactating dairy cattle do have a superficial caudal epigastric vein, but it is not supposed to be used. In ruminants and rodents, you can use the coccygeal vein, which runs on the ventral surface of the tail, so the underside of the tail. And I have used this in rodents. It's in school, we anesthetized rats and mice, and we use their jugular veins, but you can't do that very easily on a normal rat or mouse. So if we do need blood, we usually would use the coccygeal vein.